Hello viewers, I am again with another video. It is a very important and special case that was presented in our clinic. It is a case of cardiac myopathy. So before going to start it, please subscribe to our veterinary channel to have such more interesting clinical cases. So without any delay, let's start the video. Here you can see that a cough was presented to the clinic and his breathing very excessive. I will play the video. Cough is excessively breathing rapidly. It is breathing heavily and rapidly. And moreover, if you notice the mouth, it is open. The mouth is widely open, so we can say that the cough is going through open mouth breathing. Here have a close look. Cough is breathing rapidly and it is deep breath and wide open mouth. We also check and examine the hyperemic. Here you can see it is reddish pink. So it was the video of our clinical case. So the major clinical sign here is the open mouth breathing and the cough is breathing rapid. So let's get deep into the case. The topic is myocardial disease or cardiomyopathy. It was presented at clinic medicine. If we go into the history, a male cough of 4-day age was presented at medicine clinic with the history of open mouth breathing, as you have seen in the video. And there was respiratory distress from first day and there was stress and weakness. So basically what happens is there becomes lesions on the left ventricle and the congestive heart failure is the result of that disease that results in open mouth breathing with exertion. So if we look into the clinical examination, the temperature was heart rate was very high, 120 per minute, and respiration was high, 75 per minute. We looked into the conjunctiva, that was hyperemic and there was congestion. So it was a respiratory case, so we went for lung auscultation. Upon lung auscultation, there was increased depth and there was the presence of crackle sound at the base of the lung. We also went for auscultation. There was increased heart amplitude was rising. Auscultation listen near heart of xiphoid cartilage. So upon mouth exam, the mouth was wide open and the cough was breathing open mouth breathing, and there was salivation. So upon these clinical examinations and clinical signs and upon we diagnosed it a case of cardiac myopathy, which is also known as congenital left ventricular heart failure. So the treatment for this is Duracort 4 ml intramuscular and injection diuretic, Lasix, because we were expecting the case of pneumonia and we were expecting fluids in the lungs. So we go into the etiology. It is unknown congenital cardiomyopathy. If we look into the pathogenesis, there is endogenous synthetic catechol that produce multifocal necrosis in left ventricle. This necrosis results in the congestive heart failure. Increased pulmonary venous pressure causes venous congestion and there is increased respiratory rate as a result. And there is exercise intolerance by the animal or the cough. There is bronchial capillary congestion and edema results in the encroachment on airways. When venous hydrostatic pressure is exceptionally high, net force for filtration of fluid across pulmonary capillary rise and the pulmonary edema results. That is the reason, due to the pulmonary edema, we gave the medicine injection diuretic so that the fluid may be drained out from the that has been accumulated due to pulmonary edema with this diuretic through the. If we look into the clinical pathology, we see the cardiospecific isoenzymic troponin 1, and there was increase in this enzyme. There we see the serum creatinine kinase and the LDH level was low. So after treatment, we called the owner for follow-up. After 3 days, the follow-up was the animals was presented back at clinic. There was some recovery. The cough was breathing normally. There was no open mouth breathing observed. That animal was now running. So there was no exercise intolerance. After 3 days, again animal examination, the condition was even better. So after 4 days, LSD, lumpy skin disease, has attacked these coughs. So now the case is another case has been started. So this was a very important clinical case that we have presented. Hope you have learned new things from this clinical case. So if you want to keep learning new things, please subscribe to our veterinary channel. Thank you.